So Martha asked, gee, it sounds like your plan is like the herd immunity plan. And I would say, well, the herd immunity thing is not a plan. That's do nothing. We are far from not doing anything here in the state of Nebraska. Just ask my team. They've been working very, very hard, a lot of hours. So again, we are doing things such as ramping up the testing, which we expect to get to, the next few weeks, 3,000 tests a day on top of the 1,000 tests a day now we're doing for the last 7 days. We've been doing over 1,000 tests a day. For the last 5 days, we've been doing over 1,200 tests a day. The folks at the Nebraska Public Health Lab have really just been working incredibly hard to be able to pump out that many tests. We are expanding our contact tracing. So we're going to be going up to 1,000 people doing contact tracing. Danette, our CEO of DHHS, Danette Smith, has a plan to get us to 325, I think, by the end of this week. We've got a couple of teams already stood up, and they are working to assist with our public health districts on that contact tracing right now. So we're really, again, expanding both the contact tracing and the testing. We've gone out and purchased a tremendous amount of PPE, and I gave you those numbers yesterday. Something like 1.127 million gloves were distributed, 1.353 million N95 and surgical masks. So again, we've stocked up on PPE, 45,000 surgical gowns. So these are the things that we've been able to stock up to be able to help make sure that our healthcare providers, our first responders, volunteer firefighters, you name it, have the proper equipment to be able to protect themselves. So we're taking steps on all these areas to be able to expand the kind of things we're doing with regard to working with local public health departments, local clinics, having conversations with, the CEOs of hospitals, of the long-term care facilities, of the meat processors. So again, working on all this with regard to best practices on how you can do the social distancing. We are looking to make sure that we are covering all our bases on how we slow the spread of the virus. Our measurement on determining success is the healthcare system. 2 months ago, all the public health experts said, again, the reason you do this, you can't necessarily change the number of people who are going to get infected, but you can spread it out so that you don't overwhelm the healthcare system. That's our measurement, is making sure that all the things we're doing end up in that final goal of not overwhelming the healthcare system so that everybody who needs that hospital bed, that intensive care unit bed, or that ventilator can get it. And we are successful at doing that. You look at Hall County, and Dr. Anton, do you happen to have the numbers for CHI St. Francis off the top of your head for today?
As far as how many are in the hospital?
Yeah, how many folks we got in the hospital, and how many ventilators we're using, and how many ICU beds?
I was just there yesterday and saw it firsthand that they have 34 patients in the hospital right now.
So they got 34 patients that are coronavirus related.
Yes.
In the hospital. Their capacity is about 130 or 140.
That's right, 140 is their census
Yep.
capacity. 13 are in the ICU, 10 on ventilators.
13 are in the ICU. They've got 16 ICU beds. 10 are on ventilators. I think they've got 20 ventilators they could use, right?
They do, they have 15.
15, 16 they like to use within the ICU beds, yeah.
Convert their other 4 into ICU.
But they could convert 4 other rooms into an ICU, so they got some flex capacity there. So even in a county where we have got double the amount of cases of even our largest county, Douglas County, we've been able to manage the healthcare system so that everybody's getting that health care they need. That's really what the whole goal that was laid out to us by these public health experts 2 months ago was about. Don't overwhelm your healthcare system. That's why I focus so much on that.